Murphy with the Longevity Insider, and I am here today, May 30th, to talk about a really important principle. And that principle is put the patient first. I can't emphasize this more with everyone. Sorry, I'm just going to put this in Do Not Disturb so no one bugs us while we have our nice little talk here. There we go. All right. Put the patient first. What does that mean? I think the most important thing about put the patient first is the following. When a patient has to check in, how is their experience? When a patient has to wait in a waiting room, how is their experience? When you are caring for the patient and you've got a lot of other stuff to do in your life, like today's my kid's birthday, but I am here seeing patients, putting patient care first. And that's an important principle. I'm not saying don't have a life and be with your children. I am saying when you are caring for the patients, put the patients first. Why am I bringing this up in longevity? Well, it's pretty simple. What we do in longevity, and what I've gone through a bunch of times, is we evaluate and analyze data, just like in any other field of medicine, applying a series of evidentiary reviews to make sure that what we're doing, first and foremost, won't hurt the patient. And then we do a risk-benefit analysis to see if the risks outweigh the benefits. And then we give that to a patient as an informed consent. Why am I in one of our orthobiologic ultrasound procedure rooms? Because this hot letter that just came to us via email from Dr. Lynn Sosa. So you guys may not know Dr. Sosa. I know Dr. Sosa because during the pandemic, I talked to Dr. Sosa all the time in relation to COVID. Well, guess what? She's an infectious disease epidemiologist. She's an expert. And she's not talking today about COVID. Oh, no. She is sending us a letter. Why? Let me read it. The CDC is assisting with an ongoing multi-state investigation involving the use of non-sterile ultrasound gel for ultrasound gel percutaneous procedures. Product testing identified Paraburcoldia fungorum from two non-sterile gel products. Genetically similar isolates were also detected primarily from patient blood cultures. Okay, let me explain what that means. When we use ultrasound gel, it comes in two flavors. The kind in a big jug like this, and the kind that comes in little packets. The little packet gel is sterile gel. This is not sterile. You know, we take great caution here at Concierge Medical Associates when we do percutaneous procedures. What does that mean? That means putting a needle in you. So Dr. Altman will use percutaneous needle electrolysis. He'll use an ultrasound to place it in the right position. I will use percutaneous injections into joints, into tendons, into other tissue. You should never use this big jug of ultrasound gel to do that. Using non-sterile gel on patients when you're going to puncture their skin is insane, and I can't imagine anyone who would do that. You take all the caution to make sure that you are using ultrasound guidance to be in the right location. That demonstrates care for a patient. That's awesome. But that's only get you to the red zone. If you want to score a touchdown, you should be making sure that the area is sterile and cleaning it. similar to what we do even in simple injections. Like if we're going to use Manjaro or tirzepatide on a patient, we teach them how to use sterile technique, because when you puncture the skin, you can introduce bacteria. Full stop. And our goal is to help people heal, not to hurt them. Why? Because we put the patient first. So if you're putting the patient first using an ultrasound probe, you should put the patient first using sterile technique. And you should put the patient first never using big non-sterile ultrasound gel for procedures. Why? Well, in this case, again, I'm going to reiterate. They found a bacteria, Paraburcoldia fungorum, in ultrasound gel. They also found it in patients' blood cultures. Let me explain that to you. You don't get blood with bacteria in it unless you are septic. When you are septic, you are very sick. Okay? What did they find? They found this bacteria in the bloodstreams of patients who had a needle injected in their skin. They put a needle in their skin, literally. And they put it likely through some ultrasound gel. Putting ultrasound gel on your skin for ultrasound guidance is standard of care. If you are doing it with a percutaneous, where you're going to puncture the skin, you have to use sterile gel. I have zero idea why anyone would put a needle through non-sterile gel and then put it into the patient's skin and it ultimately getting into their bloodstream. So I want to explain to you that these people probably showed up in emergency rooms after procedures septic. That means bacteria was in their bloodstream. That means it was a bad infection from Paraburcoldia fungorum, which is insane. Now, bravo to the Connecticut State Department of Public Health for doing two things. One, putting this letter out right away. That way, it puts people on notice. And honestly, I've seen it before. If you're getting like Botox or those sorts of things and they're using ultrasound, that's awesome. But I've seen them where they haven't used sterile gel. I've seen them on TikTok. I've seen them on Facebook. They put gel from one of these big things in there, and that's not okay. You have to use sterile gel. So they went and they got an injection, wherever that was, and they also got an infection because of that injection, because the gel was put into the body. It's crazy. So number one. Number two, it is excellent to tell us we should be training our staff to tell them that they need to use the right ultrasound gel products. Great. We put the patient first. In longevity, in regenerative medicine, put the patient first. What happens when you don't? Someone lazy uses gel like this and gives a patient sepsis. Number two, it tells everyone the following. The ultrasound gel products claim, without claiming sterility, don't let it trick you into thinking it's sterile. Without writing on it, it's sterile. So yes, we have to worry about marketing people. Don't get me started about marketing reps on exosomes or magical peptide products. You have to not believe them. You have to think they're all lying, and you have to validate the data. Otherwise, you're going to get burned. The one place where the state of Connecticut and the CDC failed us here is the following. I don't have on this letter which products I need to avoid. That's number one. Number two, and I think this is a more important part of it. There is, in a neutral tone, no reprimand for physicians or nurse practitioners or PAs or God knows whoever in an aesthetics practice is putting needles in people and not using sterile gel. There should be a stern warning on there that said, you've been warned, you can't cut corners anymore, you have to buy individual sterile gel, which again, basically is the following. If you put the patient first, this never happens. And the same is true in longevity medicine. If I write for rapamycin for someone, I put the patient first. I give them the risks, I give them the benefits, we talk about the data. I want everyone here to know that if they're a patient, they should be put first. And if they're not, walk out the door. Number two, if you're a provider, put the patient first. Full stop. Longevity medicine demands it. Regenerative medicine, stem cells, PRP injections demand it. Acupuncture using ultrasound guidance demands it. Percutaneous needle electrolysis demands it. Put the patient first. Do not use dirty gel to stick a needle through it into a patient. All right. I want to thank you guys very much. It's May 30th. It's my kid's birthday. We're going to have a great day. I have some patients in the waiting room right now that I've got to take care of. Thank you all for tuning in. Remember, longevity medicine demands put the patient first. All right. Have a great day. Here's to a life well lived.